Gentlemen, if I could ask you to take your seats, thank you very much. Welcome, everybody. Welcome to this lunch event, the Rotary Club of Sydney. If I can just ask everybody to sit down, thank you. And we will get started. Welcome to our guests on Zoom. Hopefully you can see and hear us clearly. If you do have any problems, so this is being recorded. We will load up a recording onto YouTube and our club website in the coming days. I'd just like to point out that for those on Zoom, we will put you on mute so that we avoid any superfluous noises. But please be ready to send us your questions via chat for our speaker. And our speaker today, I think, doesn't need an introduction. Dr. Kerry Chant is on our screens most days. So we have a fantastic speaker lined up for you. Now, this is, of course, our centenary year, and I'd like to remind everybody of our centenary project, Rotary Give Every Child a Future. And you've heard me say this every week, but I'll repeat it again this week. We urgently need your donations. We are vaccinating, or aim to vaccinate with UNICEF 100,000 children across the Pacific Islands, 9 Pacific Islands. Please donate. $45 will vaccinate a child against 3 killer diseases for life. $450, if you're feeling generous, will vaccinate 10 children for life. So it's a very worthwhile cause. And you can go to our website for the link for details of how to donate. And by the way, on your tables, there's a black bowl in the middle. If you are carrying any cash, and I know not many people carry cash with them these days, please donate, and we'll make sure it goes to our worthy cause. $5 minimum, I'm told. And once upon a time, we used to issue fines to people. For example, if you're a Rotarian and you're not wearing your badge, $5 in the bowl, please. Now, we can't force you to do that, but please, just out of generosity, whatever spare change you have in the bowl. Thank you very much. Now, that's enough of me for now. I'd like to hand over to our interim president, Kerry Chant, for Welcome to Country and other matters. Thank you.
Hello. Hi, Zoomers. Thank you for joining us. Hello, Rotarians. Thank you for joining us today. I'm Kerry Chant, and I'm the Vice President and Interim President of the Rotary Club of Sydney. I'm here representing our President, Fatima Ali. I'm proudly on Gadigal land. I recognize and respect the traditional custodians and the Gadigal people of the Eora Nation on which we work and live. Let us acknowledge their continuing contribution to land, water, and culture. I'd like to pay my respects to these traditional owners of country throughout Australia, including Aboriginal and Torres Strait Islanders, as well as elders past, present, and emerging. Well, what an incredible day today is. Today is our annual luncheon to award the Vocational Service Award. So thank you for taking the time to join us. And thank you, Zoomers, for taking the time out of your schedules as well. So we have a lot to be grateful for, given what's going on in the rest of the world. Our award recipient today will need little introduction, but I would like to formally welcome Dr. Kerry Chant, who will be speaking soon. We are also joined today by our District Governor-elect, Jeremy Wright, And we have past district governor here with us, Gary Brown, as well. I want to also welcome a number of Sydney Cove Rotarians who are joining us, as well as other Rotarians from other clubs. So thank you for taking the time and gracing us with your presence. We're very much appreciative. Right now, what I'd like to do is turn over the microphone to Jeremy Wright for the thought of the day. Jeremy.
Kath, thank you very much. And I also want to pay my respects to the Gadigal people of the Eora Nation, the traditional owners, their elders past, present and emerging. And it really helped me to think about the thought for the day, because I have a similar boss to, I have great privilege to have a similar boss to Dr. Kerry Chant, the Minister Brad Hazzard and Elizabeth Coft, the Secretary. I work for the, I'm on the board of the Sydney Children's Hospital, and I was asked a couple of weeks ago by one of your members, remain nameless, but if we approve the Uluru Statement as a club, is there, is that political or not? And I responded by saying that I'm very proud for the fact that the Sydney Children's Hospital Network has actually adopted the Uluru Statement, not for any political reason at all, but actually for operational reasons, because there is, as you may know, a history of children's hospitals not being very comfortable for Aboriginal patients. And there has been a history in the past where children's hospitals have been the place where children have been taken away from parents, which is really something that we all live with, not just the hospital. And so I was really proud that we were, as a hospital, willing to take on that statement. And we are doing our best to be much more relevant to our Aboriginal brothers and sisters. So the thought for the day comes from Leela Watson, who is an Aboriginal activist. And this inspires me in terms of how we engage, and as you as a club, how you might engage with our Aboriginal brothers and sisters and others. But if you have come to help me, you're wasting your time. But if you have come because your liberation is bound up with mine, then let us work together. I get inspired by that, and I hope you do too. Thank you very much.
Thank you, Jeremy. Thank you for that wonderful thought of the day. What I'd like to do now is ask Simon Martin to come up to introduce our guest speaker for the day. Thank you, Simon.
Welcome, everybody. Nice to see so many people here at our luncheon meeting. I'm going to just give you a little brief rundown on the Vocational Service Award, the history of it. Many people here perhaps don't know how long this award's been going. Bill Neal's going to give us a little presentation with some details on Kerry, and then we're going to present Kerry with the Vocational Service Award, Dr. Kerry Chant. I've been involved with the Vocational Service Award for many, many years. Being in Rotary for 30 years, I've seen this award presented year after year after year. In fact, this award has been going for 60 years. Started in 1960. So, Kerry, I'm not sure whether you're the 60th or 61st to receive it, but it's certainly probably the longest award this club continuously has ever made. It's become a very important part of the club and what they do each year, and recognising. What would I say? I'll give you the details of how we define it, because that's probably an easier way to explain it. The award itself has come, sorry, I'm on the wrong page here. Here we go. The award, thanks. The Vocational Service Award is presented for outstanding application and excellence. within the recipient's vocation in the context of Rotary's service above self, value and the wider community benefit, professional or otherwise. In selecting a recipient, the Vocational Service Committee considers the service above self nature of the recipient's activities, the community value of the recipient's service in their vocation, the professional regard in which the recipient is held in their vocation, the regard in which the recipient is held in the community, and the good character of the recipient. So, Kerry, you fulfil all those that we had to go through, and in considering you being this year's recipient. Just as a bit of history, the first recipient of this award in 1960 was the Hudson Fish, the founder of Qantas, who happened to be a member of this club at the same time. Recipients of the award have come from business, industry, trade unions, medicine, social welfare, churches, universities, the judiciary, public servants, arts, journalism, governors and governor-generals. Many, many, many vocations. To mention a few notable recipients in the history of this award, Sir Bernard Hines, Dame Joan Sutherland, Sir Roden Cutler, Sir William Dean, Her Excellency Murray Bashir, and recently David Gonski, Honourable Justice Michael Kirby, and many others. And last year's winner was Shane Fitzsimons, the New South Wales Rural Fire Service. So you're in wonderful, wonderful company there, Kerry. Some very fine people that have been in our a recipient of our award over many years. I'm just going to quickly ask Bill Neal if he would step forward just to speak a few words about Kerry, and then I will then proceed to make the award. Thanks, Bill.
Kerry, when I was asked to introduce you to the club, I thought, how the hell can I do that? Everyone knows you. I can say a few things. You're the New South Wales Chief Health Officer and have been since 2008, held that position longer than anyone else. Congratulations. You're the New South Wales Premier's Woman of the Year and Public Servant of the Year. Very recognised. Grew up in Punchbowl. You grew up in Punchbowl, went to Deerbank Anglican Girls' School, or School for Girls, and went to the University of New South Wales, where I went. You've got bachelor degrees in medicine and surgery, and you're a Master of Health Administration and Public Health. You joined the New South Wales Health Department in 1991, and you live in Epping. That's what I can tell you about her factually. Let me say that we all know about COVID-19 and what we went through. And as that progressed, I was reminded by Kerry of Winston Churchill, who in 1941, with all the resources behind him, Army, Navy, the best Navy in the world, Air Force, knew he needed people to get through the battle. So he brought the people into the battle. And that's what Kerry did. When we had COVID-19 before us, we had a wonderful health system, very skilled and talented doctors, nurses, paramedics, health administrators, but they needed the people. And someone had to get up and tell us why, how, and when. And Kerry did that. And we thank you very much for that, Kerry. We're very much indebted to you, and more so for coming today. Thank you.
Okay, we're going to make this presentation. The Rotary Club of Sydney is presenting the Vocational Service Award to Dr. Kerry Chant, PSME. Vocational. Dr. Kerry Chant, PSM, is a public health physician who is the Chief Health Officer of New South Wales, Australia, since 2008. Dr. Chant has been with the New South Wales Health Department since 1991, working in the areas of infectious and communicable diseases, prevention and control, and Indigenous health. She is currently the Deputy Secretary, Population and Public Health and Chief Health Officer. Prior to this, Dr. Chant was Director of Health Protection and Deputy Chief Health Officer. Dr. Chant is an inspiration for all women. Her leadership and dedication to public service, especially during COVID-19, has been exemplary. Throughout the COVID-19 pandemic, Dr. Chant has been a familiar face, providing regular and vital public health advice for New South Wales, a contribution for which she was named New South Wales Premier's Woman of the Year in March 2021. The Rotary Club of Sydney recognises Dr. Chant with a Vocational Service Award in acknowledgement of her impactful and distinguished service to the community and dedication to vocational service. I'd like you all now to put your hands together and congratulate.
Firstly, I too would like to acknowledge the traditional custodians of the land on which we're meeting and pay my respects to elders past and present. And can I just say how overwhelmed I am about the award? But I really want to stress that I'm accepting the award on behalf of the team, and that team is really across government, across health, and across the community. And thank you very much for the introduction, because one of the key components of the success of our recipients has been the community and how wonderful we are to live in a country like Australia at this challenging time. I'm happy to commence my presentation, but also happy to receive any difficult questions, because as I've indicated to a few of you, and as we had an opportunity to talk prior to this, we are really partway through the journey and we have a long way in that journey to go. There'll be some interesting catchphrases for the future around technology, won't they? It's successes and its challenges. Thanks so much. Okay, thank you very much. That's all right. Just down. Okay, next slide, thanks. So I just wanted to touch briefly on the current approach in New South Wales. So we obviously have some baseline measures to protect the community from COVID should an incursion event occurring. So at the moment, we're aiming for no community transmission. And what we've done is looked at fortifying our borders. Wherever we come in contact with people who may have brought the disease to our shores, and that's airports, ports, returning travellers, flight crew, our freight industry. We've ensured that people are quarantining from overseas. We're also ensuring that people are vaccinated, again, as that ring of defence. But we've seen how recently there's been a number of incursions. And so COVID can be quite a tricky virus. Despite all of our protections, we have seen some recent incursions where we haven't really found the mechanism. So that relates to our gentleman from the eastern suburbs, which obviously was linked back to a returning traveller, and also the recent cases in Melbourne. We've had targeted restrictions in response to small outbreaks and clusters. And over the period of time for COVID, we've actually learned a lot about how COVID is transmitted, what settings tend to be most risky. And just to recap, they're things like household gatherings, they're hospitality settings. Unfortunately, COVID is amplified when we're using loud voices, when we're having fun, when we're laughing and shouting. So things that generate aerosols and droplets are things that potentially spread, particularly indoor environments. The outdoor environments remain much, much safer. We've also had international border measures to prevent the incursions. And as I said, we've done those rings around our border workers and our ports in order to give us another line of defence. We've got 2 vaccines that are currently approved for use in Australia following assessment of the TGA, and they are the Pfizer vaccine and the AstraZeneca vaccine. We're rolling out the vaccines, and the reason vaccination is so important is that it has both an individual benefit in the sense that we know the vaccines are generally good at protecting against severe disease and hospitalisation. But we also know now that they also have a benefit of reducing your risk of transmitting to others. So no vaccine is 100% effective. You can still get the disease, but even so, you're less likely to transmit it. And because of those factors, overall, once we become more highly vaccinated as a society and as a community, then the ability for the disease to get a foothold is reduced, and that's the aim of vaccination. The virus is also changing, so we know that we have got variants of concern. So COVID vaccination is likely to be with us into the future, a bit like flu. We don't know the frequency that we'll have to give it, but ultimately the vaccine will have to change and respond to the new vaccine variant, particularly when the previous vaccines are not as effective. And obviously we're encouraging people to be vaccinated, and we're clear in relation to the AstraZeneca that there are some side effects from the AstraZeneca, side effects from all vaccines, and it is important that people take note and read all of the information to make those decisions. But vaccination is essential in our pathway to return to a COVID normal, but COVID normal will not look like pre-COVID normal. Next slide. So for me, some of the key lessons learned are around the importance of community and stakeholder engagement and partnership. We've also needed to build evidence and continually learn and evolve based on new information. When we think about this, was a new virus back in beginning of 2020. It emerged earlier, but we had to learn so much about how the disease spread. Things like incubation periods, can you catch the infection prior to symptom onset? And also, would we ever have a vaccine? Like, it's fine now that we've got lots of different vaccines. But when I asked experts way back, they would have said we haven't developed an effective coronavirus vaccine. So policymakers and the community were probably grappling with a lot of unknowns through this. And I think it's always important that we remember the degree of unknowns that we were dealing with at certain points. We've had to use experts and evidence and data to inform our response. And I've got to say, the world has collaborated. So we've been sharing information rapidly across international boundaries. However, there are some things that is unique about the Australian context. So when we pick up information from overseas, we always need to say, how does this apply to the Australian context? Is it relevant? And what is the circumstances that evidence was generated? And the other component is the importance of the integrated health system and whole of government response. And I think this is highlighted in the bushfires, highlighted in other mass disasters. We really need to all work together, and that's all sections of government agencies, non-government, as well as business and the community. Next slide. So for me, good leadership involves much more than directing operations or making decisions. It really requires a strong team and a diverse team, and people with different views, and people that are prepared to challenge the paradigm. Because one of the challenges is you've got to work in the operational now, but actually have sufficient space to think about the strategic future. And that's often those competing demands are quite challenging. You've also got to take time to listen to your team for their insights and opinions, and also test your own assumptions with those around you. And the feedback we received through a lot of the community engagement tells us what are the fears and concerns of the community, what they understand and don't understand. So even things like social media feedback through our other government agencies who led the consultation through Multicultural New South Wales. All of those avenues give us important intelligence to hone our messages, to highlight areas where people are not understanding the rationale behind it, because we know if the community understands the need for action, they're more likely to embrace that action. Next slide. So for me, a key lesson is that the community is part of the team. Community acceptance and cooperation are a necessary part of teamwork, and community leaders have a key role to play. Be they the leaders in Rotary, be they the leaders in local government, be they religious leaders, be they professional leaders, be they business leaders. The importance of leaders amplifying messages, but also challenging. It's important that we continue to challenge ourselves and ask us, is there a different way forward? Is there a strong evidence base, or how we can generate that evidence base in uncertainty? It also requires bringing people on the journey through communication, transparency, and respect. And for me, that we are part of the way through the journey, and I'm very conscious that we can lose that respect and quite quickly. And so it really is important aspect that we continue to communicate well and we are transparent. We've also got to listen to the community concerns and balancing COVID risks with public health measures with other impacts such as economic. We can't manage one risk down to zero, but create a lot of other risks. That's not what public health is about. And understanding that and communicating again that to the community is essential. Next slide. Just wanted to focus on some examples of areas where we had a particular focus, or just as an illustrative example, and it highlights that there is the whole, but then there are sort of areas that we need to particularly focus on. For us, schools was a key issue. So if we take you back to the beginning of 2020, there was a lot of debate about, do schools amplify infection? Do we need to keep them closed? Do we need to, what was the settings for schools? And there wasn't a lot of information in the presence of low COVID risk in the community about schools' roles. We know from overseas that schools can amplify, particularly in the context of community-wide spread. So we had to partner with the National Centre for Immunisation Research to do some investigation around how children spread the disease, and we also developed, in partnership with education, COVID-safe principles for schools. We recognise the importance of schools for early learning, schools are the best place for children to be. Structured learning, those supports. And so again, we didn't want to be closing schools prematurely if we could find a safe way to keep them open because of those other important benefits for children attending school. So that highlights one piece of work. Prison population, correctional facilities. Clearly, the implications for a correctional facility outbreak are great. And so there was a lot of work with our justice colleagues about how we could keep new prisoners segregated, how we could then test them and clear them before we're sending them into the prison population, how we can move to more virtual programs with our justice system to again be COVID compliant, but again, trying not to close down our courts and other important institutions. The called community is a community which is a diverse one, and we've had to again work with very many people to reach the community effectively, but also understand their specific concerns. And unless you have those reach into the communities, sometimes you miss key issues or concerns. Like, for instance, some communities were actually found COVID to be a stigmatizing disease. Now, for me, I would see COVID as just not anyone's fault you've acquired COVID. But understanding that allows us to change the messaging to make sure that people don't feel reluctant to seek care because it's somehow seen as a stigmatizing disease. That's just one example of the importance of really understanding the community and understanding their fears, concerns, or even what they're having difficulty complying with, because then we can actually, as a government, and work with the sector to know how we can make it easier for them to comply. Aboriginal Torres Strait Islander people, we know Aboriginal people have had a higher underlying burden of chronic disease. We know that our remote communities struggle with access to healthcare in some cases. So it was imperative that we worked in partnership with the Aboriginal Health and Medical Research Council and our AMSs to actually ensure that we did all we could to put in supportive measures to prevent a disproportionate burden on Aboriginal and Torres Strait Islander people. And I've got to say that that's been one of the key positives out of the response. And it goes down to the impressive work that the community themselves did to keep themselves safe. So alcohol and other drug services, again, marginalised communities need particular attention, and there was a lot of work at how we could keep some of our programs going, again, to assure good outcomes for the community and create and support that access to care. Next slide. So this is my horizon scanning for what we might expect for the rest of 2021 to look like. So with COVID, don't hold anything to this, but this is my vision. So we're obviously going to be continuing to aim for no community transmission whilst we roll out the vaccine. It's we know that once COVID gets a foothold, particularly the variants of concern, with our current settings, which are not that restricted, we will see transmission and we will see the disease grow. So we do need that buffer of the vaccine with the vaccine coverage. We acknowledge that COVID will be present for the foreseeable future, and we will have to accept community transmission. And that's probably going to be a discussion we're going to have to start having now, that once we are adequately protected by vaccination, there will need to be that shift in community attitudes to accept some degree of transmission. We'll go away from counting necessarily numbers of cases to hospitalisations and severe outcomes from COVID. So we will have to change a range of our responses at that time. We will need to continue to use vaccines when they become available. So even some of the companies now are developing second generation vaccines against the variants of concern. International border measures will likely to continue whilst we're in that period of no community transmission. And we will likely to maintain some COVID safe practices for some time. And I challenge us to think about some of the things that we probably want to retain forever. So we've probably underestimated how we transmit respiratory viruses in workplaces. And so that message of, it's fine, you might be well enough to come to work, but how about you do those meetings by Zoom, might be a good thing we keep into the future. The hand washing, just attention to some of those basic measures have really seen a plummeting of other diseases. And so can we hold on to that? So we're going to have to learn what are the measures we need to maintain. Will we need to maintain some social distancing? We may need to have a focus on particularly vulnerable settings, such as hospital aged care facilities, even if there is a highly vaccinated population. We may need to have some interventions when there's outbreaks, and they may be in boarding schools or other very closed settings. So the COVID future is one that we're working on now, but it will be accepting some level of community transmission. Next slide. And then what can Rotary community do for us? You are a diverse group, and so I suppose support the COVID vaccine uptake, continue to champion the COVID safe measures, and continue to raise concerns with us. As I said, all of the feedback, all of the letters we receive actually give us important intelligence, and there's sometimes some very simple things we can do in response to that. So please don't hesitate. Keep raising those questions, raising those good ideas, and asking difficult questions or raise any of your concerns. Thank you. Happy to take some really difficult questions.
Thank you very much for that. What we'll do is I'll take questions from the floor and from our Zoom community, and perhaps the one from the floor, you could just repeat the question for your answer. But maybe I could start off.
Yes.
In many industries, they've been, banking as an example, they've been asked by the regulatory authorities to prepare their pandemic planning, going back years ago. The reality of the COVID pandemic seemed to have completely far exceeded what was planned for. Was that the same experience in government and in health circles? And where were the biggest gaps?
So the question really relates to the fact that business had, sorry, they would have heard that. I think again, we need to put ourselves back into the early in the thinking early on. We know that a lot of the pandemic planning was based on influenza, and probably we learned that influenza is hard to control because it's spread before you get onset of illness. And to some extent, there would have been a thought that if there had been a new pandemic, it would have actually been hard to close down. However, we have learned that border measures, actually, we have no flu, almost zero flu at the moment. And there's a real debate about when will flu return and what will it look like. So clearly our border measures have also been effective against flu. So a lot of the planning in the pandemic was around influenza and some of the thoughts about whether we could actually prevent or contain influenza. And I think we've just learned a lot about COVID. And I think it goes to the timing of when you pick up a new disease and its characteristics. And I think we've learned things now that will then colour our future responses.
Thank you very much. I have a question in the corner. Thank you.
So we do work cooperatively across all government agencies, all jurisdictions, and to be perfectly frank, that's one of the strengths of the response, that even from the early on, we started to meet as Chief Health Officers, convened by the Commonwealth Chief Health Officer at the time, which was Dr. Brendan Murphy, and Dr. Paul Kelly is the current Chief Medical Officer. There are committees that meet underneath it that refine what we do for contact tracing, who do we find, what are our incubation periods, all the testing. So all of the technical aspects of the response are very much coordinated and coherent across the jurisdictions. And we also share learnings. And that then informs a new iteration of various documents. I think one of the key factors is that there's often a lot of local knowledge and your capabilities and your system, which influences your decision making. For instance, I would be really confident that if there was a COVID case amongst us, and I'm not saying that I wish for this, that I would absolutely be able to know that everyone here would have signed in at that reception, because you couldn't get in here without QR coding, right? So that's a context. So this function, I would be happy I could get all of you really quickly, and get onto you, you'd have your mobile phones, I knew I could lock you down pretty quickly. If I was then dealing with another sort of setting where I knew that QR compliance wasn't a thing, it was an underground rave party, or it was a party where people weren't being particularly compliant, younger people, all of that changes the contextual risk for me. And so some of the differences is around that capability. So for us with the QR codes, it's been a great strength. It gives me greater confidence that I can reach people really quickly. And it's also our local public health units, which have really had that local knowledge and given us better intelligence around what the risk is and how we can work with communities. So for me, there'll always be some differences in how states respond. States are structured differently, risks are different across the states. But we do share our learnings.
Got a question from one of our Zoom viewers first, if I may, Mark Dyer. Regarding our recent COVID case from the eastern suburbs, it was surprising there was not more community transmission, given the Victorian example. Was this just luck?
Look, there is always, we know that COVID is spread through a few different, so COVID is spread through clearly airborne droplet. We know there's a factor of how infectious the person is, and we know that a lot of people don't transmit, and then some people transmit lots. So there is an individual variability associated probably with your viral load. We also know that putting in the mix the behaviours. So if you're singing, shouting, basically having fun, or those sort of things do lead to droplets. And if you're doing that in indoor environments, that increases risk. And then we know that your circumstances, how many people in your house, your distancing and your behaviours also then add to risk. So those three dimensions, one you could call luck, which is just the individual person. I mean, we've had some people where we've gone, oh my God, how lucky were we that they weren't spread transmitters. But the other factors in general, we know it's about environments. So household environments where there's a large number of people and household gatherings. That's why when we often implement restrictions, everyone goes for household gatherings, because that's a very significant risk. 30 to 40% transmission in household settings, in household environments. So I hope that answers the question. There's probably a multiple factors, but it is about, and can I just thank that gentleman for coming forward for testing. So great, that person tested really quickly, and that transmission event was picked up in a very short period, whereas the longer you've got between your index source case and the next case, it means there's been multiple opportunities for the transmission to occur. So that's why finding the source, and in the absence of finding that source, we live in this area of real uncertainty, because you just don't know how far the disease is spread in the community. And so that's why we do also need the community.
It's me. I'm supposed to be attending
And we also need,
yeah.
we've complemented that by our food surveillance.
15 minutes late, and I've got a thing with a student.
I think we have time for a couple more questions. We'll just put somebody on mute there. Lena, you first, please.
Yeah. So look, the issue is around AstraZeneca. So currently we have 2 approved vaccines, Pfizer and AstraZeneca. The Commonwealth Therapeutic Goods Administration is the regulator in Australia, and also the Australian Technical Advisory Group on Immunisation provides advice. So ATAGI has looked at the performance of AstraZeneca, and it goes to the risk benefit. And that's why for the AstraZeneca, as with all vaccines, we encourage that risk benefit to be considered. We do know that there are some rare conditions associated with it, which we're taking very seriously, and ATAGI will continue to monitor that advice. So what they've based that on is the risk of COVID itself can cause death, disability, it can cause those issues. So what they've done is, if you go to the ATAGI website, they've done a decision support tree, which looks at if you were in the second, I think they've used the second wave of COVID in Victoria, and then modelled that if we had an outbreak of that nature, what it would look like in the community and where your risk would sit. This is always continually under review, and Australia itself is generating very high class data in relation to this. And that's because we are also not a health system under, yes, we are under stress. Our health system is always busy, but we also have the ability to look for signals and investigate cases very thoroughly. So we will be also contributing internationally to the data. And as more information comes, those groups need to consider the guidance. We know that the Pfizer supplies and Moderna are going to come, but they're going to be back-ended. We think the advice we've got from the Commonwealth is that the supplies will start to ramp up with those alternate vaccines. So really it's that context of in a constrained supply, these are the vaccines we've got. And if we had an uncontrolled, a situation such as Victoria, this is the risk benefit. And so clearly for elderly people, and I'm not saying 50, I'm just saying elderly, if you're a 70-year-old, clearly the AstraZeneca is on the risk benefit, a very positive on the benefit side.
Quite a few more questions have come in, but unfortunately we're out of time. My apologies to those who missed out. But what I'd like to do now, if you'd like to stay here, is invite Bettina McMahon, CEO of Health Direct, to come up and give the vote of thanks.
Thank you, Dr. Chant. Thank you, everyone who's joined us on Zoom, and for those of you in the meeting. We were having a conversation earlier before lunch about the success of Australia's response being in large part due to the willingness of Australians in our community to listen to health advice and to act on that advice. And the conformance and compliance of our community has been extraordinary. However, that's not just to be assumed, it had to be earned. And it was in no small part earned by the professionalism, by the genuine authenticity of people like yourself, Dr. Chant. All of us who work in the health sector have seen your openness to new ideas, to the evidence-based policy. Even today, it doesn't feel like sugarcoating or whitewashing anything. It's felt like a very genuine passage of information to us. So thank you for all of that fantastic work. I've experienced this firsthand. I've worked with the chief medical officers, including Dr. Chant, Brenna Murphy and others over the last 12 months in the Australian Digital Health Agency, where I was previously CEO and now Health Direct Australia. So if any of you are interested in getting a vaccine, haven't had one yet, you can go to the eligibility checker and you can book in. There's many places across the country and across the city where you can get one. And for those of you who are joining us remotely as well. So I encourage you to do that, although I think I'm preaching to the converted in terms of Rotary being a big supporter of vaccines generally and has been over its strong course over history. And a final note I wanted to make, when you were being awarded this prestigious prize earlier this afternoon, there was a comment that you are an inspiration to women. And I'd like to reinforce that. You know, when I was, I'm mid-career and when I was around that table last year working on the government's response across multiple portfolios, to see you, Dr. Chant, to see Elizabeth Koch, to see Carolyn Edwards in the Department of Health and Glenn Speecham as well, to see these women in the most senior positions is a true inspiration to me and a great role model, so thank you. And I'd like to also, I'm delighted to be able to announce that on behalf of you, Dr. Chant, today, the Club of Sydney is donating $100 to the Give Every Child a Future program, which is helping to immunise 100,000 children across the Pacific Islands against life-threatening diseases. So please, if anyone else would like to put small $5 notes in those goals, that will be appreciated, and that's a contribution on your part. So thank you very much, Dr. Chant.
Thank you, Bettina, and thank you very much, Dr. Chant. And what I'd like to do now is we have a special presentation. So I'd like to invite Kathy Tate and Lena Smith up to the stage. Thank you.
Hi, everyone. And for those of you who weren't inspired before, you certainly have been inspired now. Thank you, Dr. Kerry Chant. So this is the part of our Rotary meetings, which really is one of the best privileges. But before I begin, we have amongst us in Jeremy Wright, our district governor-elect, was just awarded an AM yesterday. Jeremy, let's give a big hand to Jeremy Wright. So well deserved. Thanks for joining us today, Jeremy. Okay, Paul Harris once said, Perhaps dreaming is not so bad if one dreams good dreams and makes them come true. In Rotary, we make dreams a reality through extraordinary projects and activities here at home and around the world. Today, we are recognizing Dr. Sanu Bhaskar, our newest Paul Harris Society member, for enabling Rotary to make an impact on individuals, families, and entire communities. Sanu, can I ask you to come up here, please? As well as Dr. Sanu Bhaskar, we are also going to honor one of our Rotarians who's been with us for 30 years. That is Simon Martin, who is receiving, Simon, you have to stand up. I'm sorry, and you have to come to the front. The presentation of the Paul Harris Fellow Recognition is the Rotary Foundation's way of expressing its appreciation for a substantial contribution to its humanitarian educational programs. We thank you for demonstrating in your life and vocation a commitment to helping persons in need here around the world. We urge you to wear the Paul Harris Fellow Pin to all Rotary events as a symbol of appreciation. Now, you're wondering, who are these folks? For those of you who don't know, and I'm going to be very brief because we have a citation copied for them. Simon, I would call our mini Warren Buffett of the club. lofty shoes to fill. But Simon has been extremely successful in achieving some phenomenal investment results for us, amongst others. And Simon also, of course, has been dedicated to the Vocational Service Award. So mini Warren Buffett, let's see here. Yes. And Dr. Sanu Bhaskar, who is our Director of Membership, who has carried out his duties with diligence as well as integrity. And we are so proud to have him as part of our Rotarian family. Dr. Sanu Bhaskar also has huge accolades in the medical field, and of course has headed up the, I'm not going to get this right, but the brain clot, oh, I'm told at the bottom, so give me a moment here. The Rotary Club of Sydney recognizes Dr. Sanu Bhaskar in acknowledgement of his exceptional contributions to the Rotary Club of Sydney, Rotary International, and the broader community, as well as his humanitarian service worldwide, exemplifying the Rotary model of service above self. His numerous prestigious achievements and recognition in local and international sphere on both the vocational and community fronts stems from his passion for humanity, health, and social justice, all while delivered with the best bedside manner from hospital to boardroom. So your compassion and sympathy and empathy flow genuinely from a brilliant mind that reflects an honest psyche, shaped by inclusive and egalitarian ideals. My goodness, that's what the citation looks like. So, Simon, not that I haven't read yours, but At this point, we'd like to award, and if I could ask you to stand up and congratulate our Paul Harris Fellows, please. Oh. Yep. Okay, if that wasn't enough, and again, this is one of the more pleasurable activities you get to do as an interim president, we have yet another celebration and accolade. Our centenary year has been a memorable one. We have two individuals who have given a life of service. We are honored to present the Rotary Foundation Certificate of Appreciation from Rotary International. So where do we start? Gary Brown, AM, past president, past DG, national chair of the Centenary Community, and Robin Brown. And Robin, we know none of this is possible without you and your dedication as well to community service. You have given tirelessly of your time, service, funding, but most importantly, of your hearts to our club and nation. Across Rotary, recently, Gary was the recipient of at our district conference of the Service Above Self Award, one of the highest honors to be given in the global Rotary world. Robin, you are part of this, very integral part, and Gary could not have done this without you. Thank you, and in recognition for everything you do for the community and for your Rotarian family. You are pillars, our role models, and it is a privilege to present this recognition. Say it. No.
Fellow Rotarians and friends, it's not often that I'm speechless, and I was caught off guard, certainly at the district conference. But I feel as if I'm actually checkmated today, not really knowing what was ahead of us. Both Robin and I are absolutely privileged to receive and honoured to receive these awards today. But we do it because we enjoy and see the benefits that really occur by giving back to the community, but also with the club in which we are members, or I specifically. It is a unique and special club, and Rotary is a unique and special organisation. And the centenary was the opportunity to actually shout from the highest treetops to tell the world, or certainly tell Australia, how good Rotary is and how important it is to deliver on our mandate. There is still so much work to do and so many opportunities. And I think that we as Rotarians have to get out there and tell people how good the organisation is and how great it feels when you can improve the lives of those less fortunate. Thank you very much for this award, and thank you for all that you do for Rotary and for the broader community. Thank you very much.
And before Kathy wraps up, may I ask all the award winners for today to come up here for a photo shoot? Simon.
Okay, I promise this time I won't choke up. What a day this has been, and what an afternoon. Now, none of this is possible without you, your wonderful service, your giving of self. So what I'd like to do is invite you. Next week, we are going to have an offsite meeting at UBS. And that's with the joint country head of UBS, Nick Hughes. June 29th represents a changeover to the club, and we welcome you to that as well. Again, none of this is possible without you. We ask you to support our President's Project, Rotary Give Every Child a Future. It's our key international project, and it needs your contributions. Thank you for all that you do. Please take care of yourself and each other. Thank you for Dr. Kerry Chant, who was honoring us by accepting this award. We should all be very proud. And finally, a quote from a health hero. A hero is someone who has given his or her life to something bigger than oneself. I think we saw that exemplified today, not just in Dr. Kerry Chant, but also in all of you and our award winners today. This could not be possible without a team. As you know, it takes a bit of a village. So I want to formally thank Adrian Lozano, who makes this all look somewhat seamless. I want to thank Jeff and Gillian Wilbo, who helped do a lot of the pre-work. Thank you to Lena, and thank you to Sanu, who also helped us put it together. And thank you, Glenn, for doing wonderful MC duties. So onwards and upwards, and enjoy. Take care. Thank you.